Welcome to Movement with Fortress. Dr. Amy here with you guys today. Thanks for joining in. We're going to get right to it. So today's focus is going to be more of the lumbar spine or the lower back, as well as the hips. Now, pending your time constraints, you can go through this movement routine 1, 2, 5 times, 10 times, whatever. Again, this is a resource for you so that you can utilize this. Most likely, I like to perform some type of movement or cool down routine into the actual cool down. So after I train, and hence I just trained in the garage today. So lower body, more so lumbar spine focus and hips. On my said whiteboard to the side, there's 1, 2, 3, 4, 5 different movements I'm going to help guide you through, and probably I'm personally only going to perform this once, maybe twice, but for your purpose, pending your time constraints, feel free to go as many rounds as you may. So first movement is a standing forward fold into an overhead reach into prayer hands, kind of like a yoga pose that I really enjoy, and we're going to do 3 reps of that. So we'll get right into that and then go into every other movement that I have described on the board. So this is what it looks like from the side. Again, 3 standing forward folds into prayer stretch, overhead reach. So this is what it looks like. So just gonna gently, if you can, touch the floor. We're gonna widen our arms as we come up, reach overhead into prayer hands, into an upright posture. That is 1 rep. And we are live, people. There is traffic outside right now. Into another one. Little hamstring stretch. Reach, 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 reach. Prayer hands overhead. Come to your heart. And I'll show you the last one facing forward. Next movement, I like to call it the Cat-camel. We're gonna do 10 of those. This is what it looks like. I'm gonna give you a profile view here, okay? My wrists are stacked under my elbows, which are under my shoulders. Same concept for the knees. Knees are gonna be under my hips. So what I like to tell patients is, camel, I guess would be this, or cat, I don't know, I'm confused on these 2 movements, but whatever, I call it Cat-camel. So you're going to, what I like to tell patients, twerk your butt or untuck your tail and look up as you press through the ground. And then you're going to tuck your tail, tuck your belly button, chin to the chest. That's 1 rep. Untuck the tail, look up, tuck the tail, chin to chest. And we're going to do 10 of these. So this is, I like this movement. It helps teach us slow, controlled movement, number 1. Number 2, can someone, what I like to say, disassociate the spine? Do you have the awareness to do this? I think this is number 5. I'm going to show you guys from the front so you can see me. Take your time. As you look up, untuck your tail, or you're kind of sagging your lower back or your belly button towards the ground. And then it's just opposite as you tuck the tail. I think I might have 1 more after this. Anywho, we're going to do 10. So if you're on number 9, do another one. Good. All right, this leads us into sitting on the ground. See how I do that. So we're going to go into 3 seated, hand-supported hip shin rotations. That's kind of very detailed, but you're going to get yourself in this supported position. So I'll show you from the side. Just hands here, okay? My feet are going to be width or a little bit wider than our shoulders. I'm going to try to maintain an upright posture, so heart forward, and I'm going to slowly rotate my knees to one side without rotating my upper body. So I'm really using support through my arms. I'm going to go about 3 to 5 on each side. That's 1. Try to keep that heart forward. When we get to this, trying to get the knee to the ground, if you can, you'll want to round. We want to try to stay nice and tall because our focus is to get that ball and socket joint of our hip to rotate the ball, i.e. the femur or the thigh bone, to rotate in the socket. I'll show you guys from the front what this looks like as well. I got 2 more reps. Hand support. Rotate to one side. See how shin. It's kind of what I call shin rotations. And you might feel restrictions from one side versus the other. It's just something to take note in as you become more confident in your movement. I'm gonna go one more time on each side. I think I did a little extra, but that's okay. A little extra doesn't hurt. Okay. So after this, going to get into kind of just slight ankle focus because that's going to translate up into our lumbar spine and hip. So half kneeling, ankle, dorsiflexion. We're going to hold that position, trying to get our knee over our toe as far as we can without the heel lifting. So I'm in a half kneeling. You can totally grab something for your knee for support that you're kneeling on. I'll show you guys at an angle. My goal is to keep this heel down while driving my knee forward into this ankle dorsiflexion. So sometimes I'll get into this little like runner's lunge. I'm gonna hold this for 30 seconds. Got my little clock going. Now I'll probably get a little stretch back here into the hip. That's fine if you want your foot flat like this or tucked, doesn't matter. The goal is this front foot. I'll show you on the other side how I'm kind of blocking the outside of my leg so the hip doesn't dump forward or out to the side. My knee doesn't dump out to the side. I'll go about 10 more seconds. So I'm really trying to focus on keeping that front heel, this heel down on the ground. We call this ankle dorsiflexion. I'm going to slowly come out of that. I'm going to switch legs while facing you. So again, do 30 seconds on your opposite foot. Really trying to get this knee over the toe type deal. So I'm kind of in this runner's lunge position, as you can see. So I'm just taking the bicep of this outside arm and just locking it so that the knee doesn't deviate out. If I want a little bit more pressure, I'll honestly push my knee in and lean over with my chest to help keep my heel on the ground. In about 30 seconds. More seconds for me, maybe a little longer. I feel more stretch on this because this is my boo-boo leg. All right, then this is going to lead us up into the standing position, into what I like to say in the physio world, repeated extension and standing, or kind of back bends and standing, with a little bit of overpressure. So there's 2 ways for overpressure for this. Hands on the hips, like so, or hands on the booty, kind of, if you guys know where those little dimples are in your butt, right above your butt cheeks. I like to put the palm of my hand in that spot. Whatever's comfortable for you. So repeated extension and standing, we're gonna do 5 of these. So it's like this. Feet shoulder width apart. All I'm doing is bending back over my hands. Pressure on, pressure off. I am giving myself with my hands just a little bit of like shove forward, just a bit. I really, honestly, I'll see a lot of patients kind of like do this. No bueno. We want to try to keep our knees straight and our feet flat if we can on this particular movement. All right, because my focus is to hinge at that lumbar spine, to hinge backwards. I'm going to do 2 in this direction. I know I did more than 5. Plus, another note, if your hand is in this position like this with your palm of your hand on the dimples of your glute or your butt area where that little dimple point is, you get some bicep stretch through here. So another 2-for-1 type deal. But that's today's routine. Standing forward fold with an overhead prayer reach, cat-camel, seated, hands supported hip rotations, half kneeling ankle dorsiflexion stretch, or that runner lunge stretch, but focusing on that front foot. And then lumbar extensions or repeated extensions and standing with that self overpressure. So thanks for joining in. We'll see you guys on the next movement with Fortress.